Not every lady, not every female human being you see in a scrub is a nurse. Not every lady you see in a white uniform is a nurse. Not everybody who works in a hospital is a nurse. See, I've seen a lot of stereotypes like, oh, there's a woman down the street, she works at the hospital, automatically she's a nurse. No. In fact, there are plenty healthcare work out there. Not only females are nurses, we have male nurses too. So today I'm going to be telling you who a nurse is, because I mean, we gotta break the stereotypes. Like, there's a lot of stereotypes outside about what nursing is and what a nursing is, and I'm making a video today to tell you who a nurse is. So please, next time you see someone in a scrub, make sure to ask them, are they a nurse or what are they? Okay. A nurse is someone who has completed a program of basic education in generalized nursing and who is authorized by the appropriate regulatory authority. And in Nigeria here, it is NMCN. So anybody you see that did not go to school, and in Nigeria we have two routes, to become a nurse. Either you go to a college of nursing to become a registered nurse, or you go to university and get your degree in nursing, your BNSC, and also become a registered nurse. So those are the two ways you can become a registered nurse in Nigeria. And so if that person has not done the RN exam organized and regulated by the Nursing and Midwifery Council of Nigeria, which is NMCN, and has not passed and does not have a license, the person is not a nurse. Please, when you see someone that claims to be a nurse, ask them, do they have a license? And was that license given by the Nursing and Midwifery Council of Nigeria? We have something called auxiliary nurses. Please, let's scrap that term. There is nothing like auxiliary nurses. It's not even a legal term. Like, it's not recognized in Nigeria. Anyone you see that is calling themselves an auxiliary nurse is a quack, a quack. So please, let's be guided. If someone is not a registered nurse, I mean, if you're not registered under the Nursing and Midwifery Council of Nigeria, because some people, they will go and learn nursing like it's a trade. I mean, they are registered under one, I don't know, maybe a doctor or one matron somewhere. Please, those ones are not nurses. Even if they have one certificate, they are not nurses. Any license that is not issued by the appropriate regulatory authority of nursing in Nigeria, which is NMCN, any license like that is not valid. Anybody that has any certificate of nursing that is not issued by NMC is a quack. Okay, nursing is not learned anywhere but in a school, that is an accredited college of nursing or an accredited university. Nursing is a science-based profession. It's not just about helping. It's not just about helping a doctor. No, it's not just about being in an hospital. It's not just about giving injection. No, nursing is much more than that. Nursing is about clinical judgment. And what separates us from other healthcare professionals, we provide 24/7 continuous holistic care for our patients. We don't just treat a disease, we treat the human response to that disease. We do not just treat the problem the patients are. So we don't just care about the diagnosis of the patient. We care about the environment of that patient. We treat the human response to that disease. So to my dear so-called quacks that are being called auxiliary nurses, my dear community healthcare extension workers, chew. And my dear health attendants, you are not nurses. Well, you might work in an hospital or you might be in a clinical setting, but that does not make you a nurse. And also, please embrace your profession. If you're a community healthcare extension worker, proudly say you are one. I mean, nobody forced you to go to school and become a community healthcare extension worker. So if you're one, please be proud of it. Do what you're supposed to do and call yourself one. And if you're an health attendant in an hospital, please, if someone mistakenly calls you a nurse, please clear the air. Let them know you're not a nurse. And also, if you're interested in nursing, please go to school. Don't be a quack. Auxiliary nurses are quack. Go to school. Also, Nurses Week is not for auxiliary nurses. It's not for quacks. It's for registered nurses that are licensed by the Nursing and Midwifery Council of Nigeria. Calling yourself a nurse without a license from the Nursing and Midwifery Council of Nigeria, NMCN, is not just a lie. It is a crime. You are liable. You can go jail. So it is a crime under the Nursing and Midwifery Act. So as from now on, any auxiliary nurse, I'm coming for you. I mean it. I mean it. You're going to be accountable. Stop messing with people's lives. Like, people's lives are so important. You can't be a quack and be practicing. If you're interested in nursing, go to school and get licensed. Do the appropriate professional exams. Get your license. Do not be a quack. Thank you.